Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
This episode will air on December 2nd, which means we're in the home stretch for 2024 and about to jump into 2025. Are you ready? And by that I mean, have you at least begun planning for 2025 in your business? The problem is most people begin planning in January of the new year. But starting in January is way too late. By the time you've drawn up your plan, set up a time to brief your team, and then finally have the team briefed and moving in the same direction, half or the full month of January has gone by. You've already lost 1/12 of the year. So if anything, and I know 2024 is not done yet, the time to start looking at 2025 is right now. So without losing focus on this last month, I'd start mapping out what 2025 should look like. You know, what your goals are, what actions or changes you plan to make to achieve them. I'd also schedule when in January you plan to get with your team and get them briefed, and the earlier, the better. And to that end, if expansion or growth is a key part of your focus for your 2025 plan, where should you be placing your attention? Well, that's what I want to talk about in this week's episode. I want to discuss the 4 primary drivers of expansion in a general dental practice, along with how to determine where your practice stands on these, and most importantly, how to improve and see sustained growth. My name is Jeff Bloomberg, and I'm your host, and we'll just come out of the gates and look at these 4 things that drive expansion or growth. The first one is good delivery, good dentistry. Okay, but that isn't just the clinical side of dentistry, which, look, I'm assuming you got this as far as clinical dentistry goes, and I'm not going to even get into that. But it's possibly adding services as well as the sort of the customer service side of delivery, wait times and things like this. The second thing you probably already knew is new patients. You already probably knew that new patients drive expansion. The third driver of expansion in a dental practice is your hygiene program. And I don't mean your soft tissue management program. That's important. Again, doing a good job clinically is probably the most important thing in a dental practice. It's not probably, it is the most important thing in a dental practice. So when I say your hygiene program, I don't mean your soft tissue management program. I mean your recall program, your retention, how well you're retaining patients that are coming back to your practice. And number 4 is your sales or your case acceptance potential. Now, you'll notice I did not mention your team, and I did not mention your facility. Now, the team kind of goes without saying. If you don't have a good team, you're not going to be able to do these 4 things anyway. You might be a great dentist, but if you have an inadequate team or not great team or not enough of a team, people are going to wait, things are going to go wrong, etc. So the team is an integral part of all of this. So that sort of goes without saying. Okay, but the facility, the interesting thing about a facility is people will fixate on their facility. They'll think, I need to add another chair for expansion. And I think I've picked this up in episodes before, when's time to add another chair. And I've seen people add equipment or chairs or, features to their practice thinking that's going to drive expansion. And sure, there are cases, it's not going to drive expansion. It will accommodate expansion. It'll become more of a problem with expansion than anything else. In other words, if you're in a 2-op practice and you're working at a 2-ops and you want to add a hygienist, well, that's going to block your expansion potential. It's not driving your expansion. That's not the reason why you need a hygienist. And I've seen people think of this the wrong way sometimes. This is why I'm going to build 4 more ops, and I know if I build 4 more ops, patients will just come. Well, no, they're not going to come unless people call them. Sure, you have to be able to accommodate them, but, an empty op isn't going to accommodate a patient. You need a provider in that op. But the first thing you have to do is put a patient in that op. So I've seen plenty of large offices with huge facilities that are empty or not making their overhead. So your facility does not drive expansion. It accommodates expansion or could potentially block expansion if it's not handled correctly. It's these 4 things, delivery, new patients, hygiene, and sales that are going to help you grow. And of course, as you grow, you're going to have to get more people. That's why you hire more people. You want to deliver more or better services. You add more assistants. You add more hygienists. You want to accommodate more patients so that you can increase your sales potential. You hire treatment coordinators. You want to increase customer service. I mean, I could go on with this. You want to increase your new patients. Maybe you hire a new patient coordinator. This is why we hire new team members or hygienists for that matter. I don't know if I'd said hygienist before, is to accommodate or to help drive expansion, but ultimately it's these 4 actions that I'm discussing that are going to drive it. So what I'd suggest as a part of your growth plans for the new year is you look at where you stand on these 4 kind of key operational points in your business. And I'll just kind of run through them real quick and give you a couple things to look at as you're drafting your plans for the new year. So again, with delivery, which was the first one I started with, I'm not going to get into the clinical side of dentistry. That's your department as the doctor. You're the one who has to decide what your patients need and make sure that they actually get what they need, at the standard of care, right? So I'm not going to intrude on that. I would say there may be things you want to look at. Maybe you're referring some procedures out that you've thought of keeping in the practice, or maybe that a skill that you have to learn in order to keep those procedures. Maybe you want to start placing implants, whereas before you weren't. Then I would put that on the docket for 2025. Again, the earlier the better. To that end, again, shameless plug number 1 of the podcast. We do have a company that we partner with called DDS Clinical. We do have an implant course coming up, a basic implant course and an advanced implant course. Next year, I'll put a link to it on the episode webpage. But this is, having the ability to be confident placing implants obviously would increase your revenue potential as well as the services you could deliver to your patients. So there might be things like that you might want to add to the practice. The other thing I would look at, which is really not a clinical part of the process, or part of the clinical process, is the services surrounding the clinical process. In other words, I'd maybe do a review of my schedule and look at how often are we actually staying on schedule. Is our schedule realistic, or is it more of a suggestion? How long are patients waiting? How often does a patient wait more than 10 minutes? How often are we having cancellations or no-shows? Because that tends to throw the schedule into disarray. These are things that I would look at. They aren't part of the delivery process, but they do contribute to the delivery process, and they can negatively affect the delivery process. If you're running behind, for example, let's say you have a procedure that would normally take you 2 hours to properly do without killing yourself, okay? Takes you 2 hours, and you're asking to be scheduled for an hour and a half for this procedure. Well, a couple things happen. Number 1, you're rushed, okay? Number 2, you're probably going to take the full 2 hours because you're going to do a good job. But then what the front desk is doing, they're scheduling a patient for an hour and a half later, so then that patient afterwards is waiting. Maybe that patient was a large procedure and now they're leaving, or you're rushed in that procedure. Things like this are things that I would want to tighten up, and I know that the urge is sometimes to fit as many people on your schedule as possible, but there is a certain amount of realistic assessment involved with how much time you have in a day and how much time things actually take. So if I were you, we did a whole series of episodes on scheduling. We also have on our online platform, we have a scheduling course called The Art of Scheduling Productively, DDS Success. I'll put a link to it on the episode webpage. We also have a free seminar on scheduling called The Art of Scheduling Productively as well, I believe, that I'll put a link to on the episode webpage. If you want to tighten up your schedule, if you need policy for your schedule, things like this, because that's usually where things go wrong, not on the dentist's ability to actually do dentistry. It's the things that surround it which tend to go wrong. So that's the first thing. So I would look at how long patients are waiting and if there are any procedures you want to add and where you have to tighten things up. Second thing is new patients. Now, I could go on and on about new patients. Obviously, I've done numerous episodes on just portions of the new patient process. But what would you want to check? First things I would want to look at is how many new patients am I actually getting a month? And is this number growing? Is it staying the same? Or is it declining? Because obviously if I want to grow, I'm going to need more. All right, that's the first thing I would want to look at. Then I would want to break this down a little bit. Sort of, where are my new patients coming from? How many referrals am I getting? Because you might find if you have, 3,000, 4,000 patients, you're only getting 1 or 2 referrals a month. That area could definitely use some work, a lot of work for that matter, because, that's just not acceptable. Then I would want to look at, my various marketing efforts and how they're contributing to my new patient numbers. And I would want to break it down. You want to, and this is why it's important to track where your new patients are coming from. It's sort of a no-brainer when you hear somebody explain it, but very few people actually do it because, it takes some work and you're not the one doing it. You have to have somebody else do it for you. But it's very important to know where you're getting your new patients, because if if one source is producing well, then you can pour more resources into that source. Let's say you have 2 sources of new patients. One's, let's say it's 3, a billboard, a Google ad campaign, and a Facebook ad campaign. I'm just making this up. Just your 3 things. And you notice the Google ads are really killing it. The Facebook ads are doing okay, but the billboard is a complete waste of money. Well, then I'd probably take my billboard money and throw it into my Google ads and throw a little bit into Facebook and work on my Facebook ads a bit so that they attracted more new patients. So I'm going to want to look at the campaigns that I'm doing and what kind of responses they're getting to see if there's anything that I'm going to need to retool in this new year. Next thing I'm going to want to check is, let's say I'm getting responses, because obviously if a marketing campaign is not getting responses, it's not working. Something has to be changed. And by changed, I don't mean stop all marketing. I mean fix what's wrong with it. Next thing I'm going to want to look at is conversions. And we've talked about this at length in various episodes on the podcast in the past. But what I mean by that is when your receptionist answers the phone, how good are they at getting those patients scheduled? If that number is below 50 or 60%, you need work. And I don't care what the justifications are. Oh, they're bad patients. Oh, they have low dental IQs. Oh, they're just shopping. Shoppers can be turned into good patients. So you're going to want, number 1, to track your responses. Then number 2, see how many of those responses are actually making it into the appointment book. Because if that number's in the 20% range, 30% range, you're letting a lot of opportunity walk out the door. And, throw the money away for a second. This was a person who reached out to your practice and was looking for help, and you didn't have an opportunity to even meet them to help them. So that's an area that needs work. If your response level, your conversion rate rather, is low. I know I'm offering up a bunch of downloads here. We do have a phone skills ebook. I'll put a download to that on the episode webpage if you want it, so you can work on that with your team. If that's something that has some basic scripts in there and ideas on how to handle different types of calls. Next thing I would look at, and this is something people don't often think about, and this applies not only to new patients but also to hygiene, is availability. So let's say I'm going crazy. I'm doing all kinds of marketing, and I'm getting a lot of phone calls, and my conversion rate's not so good. Well, the first thing I'm going to want to do is listen to some of these phone calls to find out why. Maybe the receptionist is not handling them well. Maybe, they're not doing what I've asked them to do. Or, and this is something I've seen in a few cases, not a high percentage of cases, but higher than you'd think, is there's no availability. So your receptionist is fine enough. Person calls in. They've just moved to the area. They want to get their teeth cleaned or something. They're not an emergency patient, in other words. Your receptionist gets them on the phone, does everything they're supposed to do, gets all their basic data, asks them what's going on and things like this. And then the first available appointment isn't for 2 or 3 weeks. That's a problem. Okay, because you're spending a bunch of money on marketing to drive business into the practice, but then you can't accommodate that business. I'm sure you could come up with an analogy for this. I'm sure I could. It's almost like you're pouring water into a pitcher that's already full, and you're wondering why it's spilling, and you're wasting a bunch of water. So you have to have some availability. If I call your practice for a normal hygiene appointment, I moved to the area, I'm looking for a dentist, I should be able to get on your schedule within 24 to 48 hours. Some people will listen to that and go, oh, that can't be done. Okay, well, then you're losing opportunities. That's all I would tell you. Anything can be done. You can set up blocks and slots for things like that and always fill them if you have to, if you don't have a new patient to fill it. But I'm just telling you, if the patient has to wait and they are a promotional response, not a referral, but a promotional response, and you're making them wait, the chances of them not showing up increase the longer you push them off. And I want to give you this scenario. So I've decided I need to go see a dentist. And I'm looking for a dentist in my area, dentist near me, a common Google search, right? And I've asked my friends, nobody can really refer me to anybody. And I find your practice. You're 1.3 miles from my house. Look at the pictures on your Google page, and they look pretty good, and your website looks normal. So I call. I see you have a new patient special, and your receptionist is really nice, and they handle me really well, and you can't see me for 3 weeks. Now, am I going to keep that appointment? Will I even make an appointment? Possibly. And if I make it, am I going to keep it? Possibly. Really depends how badly I want to get in, because right below you on the Google ad or on the first page of Google, there's another practice that's a dentist near me. That might be my next phone call. I may or may not even cancel the appointment. I may schedule with you and just no show. And they can get me in a week. Do you see? So you have to have some availability there. That will affect your new patient numbers more than you think. All right, so that's something I would look for. And that's a simple question you can ask your front desk. The other metrics I've given you, you can probably think with. How many responses are you getting? How's your conversion rate? You can listen to your calls. As far as availability, what I would do is go up to your front desk and say, if a patient were to call in right now for a normal initial exam and cleaning, how long would it take to get them in? And if the answer is a week, 2 weeks, 3 weeks, you have a problem and you need to fix it. All right, let's talk about hygiene for a second. Now, I did a huge episode on hygiene and reactivation. I say huge because it broke the 30-minute barrier, which I don't know if I'll do this week. I don't think I will. Last week, actually, and it was the definitive guide to reactivation. So I'm not going to rehash all of that. I may revisit a couple quick points. I do recommend you listen to it because you probably have a lot of patients that you're not seeing, and this at least gives you an idea of how to get them back. But let's just take a look at this in a nutshell. Let's say you have 5,000 patients, all right? And if you want to do this diagnostic for your practice, I'm going to put a download for you here. It's called the Hygiene Formula, another download. It's free, and you can enter 3 numbers from your patient, from your software, and it'll tell you how good your retention is. But I'll give you the general idea here. Let's say you have 5,000 charts over the last 5 years. That's how many patients you've seen. Well, potentially, that's 10,000 recalls a year. If we say each of those people come twice a year, some are probably coming more. They're coming every 3 or 4 months, right? But let's say twice, just to be on the safe side. That's 10,000 recalls. Now, for attrition purposes, let's subtract 40%. It's a lot, right? But let's just do it, just to be on the safe side again. So we had 10,000 recalls less 40%, which is 4,000, leaves us with 6,000 recalls potentially. This is if you have 5,000 charts. So let's say you work 50 weeks a year. You take 2 weeks off. Well, that's 120 recalls a week, or 15 days of hygiene at 8 patients a day. So of just recall, mind you, not soft tissue management, not anything else. If your hygienist sees new patients, that doesn't count in here. That's 15 days of just recall hygiene a week. All right. So if you've got 4 days of hygiene, 5 days of hygiene, including soft tissue management in new patients, you got a problem. You're missing out. Okay. And again, I'd recommend check out last week's episode. You can download that hygiene formula that I'll put the link to on the episode webpage. But this is a big area of loss for a lot of dental practices, and it's something that I would definitely look at as part of your 2025 plan to really make sure that you take advantage of this and, for lack of a better way of saying it, reactivate your patient base. All right. So here's our first 3. We had delivery, new patients, and hygiene. Let's take a look at sales. This is a trickier one. Again, I've done numerous episodes just on sales or case acceptance. There's 3 basic things you need in order to do sales. First thing you need is something to sell, someone who needs something. So in your case, and you can apply this to any business, all right, whether you're selling dentistry or anything else. But first thing you need is something to sell. So that would be, in your case, a patient with some treatment that has been diagnosed. And where are those patients going to come from? Well, that's number 2 and 3 that we've just been talking about, new patients and hygiene. If you get more new patients in, you'll have more things to sell. If you keep your patient base active and continuously grow your hygiene department, you'll have something to sell. And not to go off on too much of a tangent, what I've seen in these practices that should have 15, 16, or 20 days of hygiene when they only have 3 or 4 is the doc will tell me, well, there's no patients in my hygiene schedule that need anything, or very few need anything. Okay, well, they're only at about 20 or 30% of their potential. So my first question is, where are all these other patients? Well, they're not showing up. They're not coming in. Nobody has time to call them. Well, in most cases, what you'll see is those are the patients that are, making the roster of your incomplete treatment list. They're just not coming back in for hygiene. So the really motivated patients, which, the upper tier of your patient base, they can be super motivated, but it's a very small percentage. Those people are showing up regularly. If you have to cancel a hygiene visit because of weather or you being out of town, they chase your office to get back on the hygiene schedule. That's just the top tier of your patient base. What about the rest of your patient base? They need a little bit of work. Someone needs to call them. Someone needs to motivate them. Somebody needs to get them in. Those are all the patients with the incomplete treatment. And because they're not there, which is why your hygiene department's so small, that's why you're not finding any work on hygiene. You can always do it. Go compare your incomplete treatment list to your inactive list. Or inactive is probably the wrong word. How about not showing up list? And you'll see a lot of the same names. That's how that works. So first thing is something to sell. So that's new patients and hygiene. Second thing is you need sales skill. You have to be able to close and handle objections and communicate. And the third thing is there's an organizational side of sales. It needs to be scheduled properly, and you actually have time to sell. So what I would look at is if you can somehow reconstruct it, it's not very difficult. Take a look at the last 1 to 2 months of treatment plans presented, not diagnosed, because you may have diagnosed stuff that you haven't officially presented, but actually presented versus accepted. And let's define accepted because this is important. If you present, let's say for ease's sake, 6 crowns to a patient, and they go, well, I only want to do what insurance covers this year. And you say, well, that sounds like a good idea. Insurance will help you with 2 of them. And then the patient says, okay, and then I can do 2 the year after and 2 the year after that, right? Yes, you can. Okay. How many crowns did the patient accept? Many people will say they accepted all 6 because they agreed to do 2 this year, 2 next year, and 2 the year after. No, they did not. They accepted 2 crowns. That's what you're doing now. Okay? So you presented 6 and they accepted 2. So statistically, let's say your crown fee is $1,200. You presented 6 crowns, that's $7,200, and they accepted 2, that's $2,400. So it'd be treatment plans presented of $7,200 versus accepted $2,400, or 1/3, 33.33%. Okay? So by accepted, we mean the patient has agreed to do it right now. Okay? That's very, very important. Now, where would I want to see this acceptance rate? I mean, at the low end, 33 or 40%. I'd like to see it closer to 50, 60, 70% would be more ideal. And the silly thing about it, if you think about it, is if you present 6 crowns and, you're talking to me, we spend 20 minutes together and you've explained all of it, you could probably spend, if you knew what you were doing, an extra 5 minutes or so and close me for all 6 rather than me walking away and only doing 2. So for an extra 5-minute investment of time to handle my objections, you produced an additional, what is that, $7,200 minus $2,400, that's $4,800 in your practice, right? And I get all the treatment I need, so this is good for me as a patient. The collections look a heck of a lot better because we're doing the full treatment plan. And you enjoy yourself. You're actually getting me fully healthy. You're not just doing 2 crowns this year because that's what insurance says. Okay, so it's actually something, this is, there's not a lot of truly win-win situations. This is truly a win-win-win-win-win situation. Everybody wins, the patients, the practice, and you as a doctor. So I would take a look at how much you're presenting, how much you're accepting, and I'd really be honest with myself and ask yourself a few questions, right? Number 1, do you feel comfortable presenting treatment and mentioning the fee? Like, is that something that you find comfortable? Maybe you enjoy discussing the dentistry, but, getting into the nitty-gritty of how the patient's going to pay and being willing to confront that, is that comfortable for you? Is that just another Tuesday for you? Okay? Are you okay with presenting full treatment plans? I've seen some doctors with a new patient especially that don't want to present a full treatment plan, especially if it's a large treatment plan because they're afraid they're going to blow them away. And again, I would examine your close rate, right? And be honest, if it's not very good or you check some of those boxes where you're having difficulty closing, you have difficulty handling objections, this is an area that you're going to want to actually do something about. And it can have an incredible effect on your practice. And I'll make my second shameless promotion here. This is where I check out the MGE Communication Sales Seminars. I'll put a link to it on the episode webpage. The average increase for someone doing these seminars is $300 a year, $300,000, $288,000 officially. But better than that, you get to do full treatment, and patients actually want the treatment that they need. So let's say you got an issue with sales. That's how you handle that. Now, let's say you don't have an issue with sales, and you're comfortable presenting. How much time do you actually have to present? Do you have time to properly explain the treatment plan fully to a patient, answer all of their questions, etc.? And whether you're comfortable or not, do you still have time to do this and answer a patient's questions without feeling pressed or like you have to run to the next operatory? Even, and I don't mean just for big cases, FMRs or all-on-X's, I'm talking about for a $4,000 case. Do you have 15, 20 minutes to explain that to a patient? Because again, remember, $4,000 may not seem like a lot to some people, but if you make $60,000 a year, that's 1/15 of your yearly income, almost a month worth of income. So that might take some doing as far as some discussion so a person really can associate the true value that it has with the money that they're going to have to spend. So it takes time. If you don't have the time to do this, or you find that you just feel rushed when you're doing it, that's the organizational side of sales. And this is really one of those things where if you don't sort the organizational side out at the same time where you sort out the closing, you could be the greatest closer in the world, and if you don't have the time to close, you're not going to close. Okay, so this is something we sort out in tandem. We cover that also at the communication sales seminars, how to set up your sales, the organizational side of sales in your practice. So those are those 4 things, right? There's a lot to think about when you're building a practice, right? Obviously, the quality of the dentistry is the most important thing, and you need a good team, right? But the delivery and these other 3 things I spoke about, new patients, hygiene, and sales, this is what drives expansion, okay? This is what makes your office grow. And I hope this gives you something to consider as you start looking for planning 2025. I hope it helps. Don't forget the downloads on the episode webpage. And if you want to know more about MGE, you can always find us online at mgeonline.com or call us at 800-640-1140. Folks, have a great week. I hope you had a happy Thanksgiving, and we'll see you at the next episode.